This video provides instructions for using the 3M Bair Hugger Multi-Position Warming Blanket Model 622 and is intended for clinicians only. The Bair Hugger Multi-Position Warming Blanket Model 622 assists healthcare professionals in managing patient temperature in the perioperative and other clinical environments. The blanket can be used with adult and pediatric patients, and it provides clinicians with maximum warming coverage in a variety of procedures and surgical positions. The 3M Bair Hugger warming blankets are contraindicated for use on patient lower extremities during aortic cross-clamping. Prior to use of any Bair Hugger warming blanket, consult detailed product indications, limitations, and safety information and instructions in the blanket model's provided instructions for use. Additional safety information specific to the product is available at the end of the video. When using any Bair Hugger warming blanket, the blanket should be placed with the perforated side directly on top of and in direct contact with the patient's skin. Active warming through the blanket should begin as soon as possible. Always connect the 3M Bair Hugger Multi-Position Warming Blanket Model 622 to a Bair Hugger Warming Unit Model 675 or 775 only. The 622 blanket's special quilted design allows it to be curved, bent, and conform to accommodate a range of surgical positions and procedures. The position of the blanket may vary based on procedure and needed surgical access. Examples of possible configurations can be seen here. The following application will be for a patient in supine, arms extended position. Noting the expiration date on the package, open and remove the blanket from the packaging. Once removed, unfold the blanket. All blankets have a 3-year shelf life from date of manufacture. Place the perforated side of the 3M Bair Hugger warming blanket, the side with small holes, directly on top of the patient in contact with the patient's skin. The warming blanket should be placed with the adhesive strip toward the surgical site. Remove the adhesive backing and secure the adhesive strip to the patient's skin. Detach the tie strips on the upper and lower edges on each side of the blanket. Tie these strips as needed to secure the blanket in the desired position. In this instance, they will be tied underneath each armboard. 2 hose ports are provided for clinician preference. Select the desired hose port and, if indicated, remove the hose port card and retain it to occlude a previously activated hose port and maintain blanket pressure if both ports are used on the blanket. If the patient is intubated and ventilated, deploy the folded head drape and place over the patient's head and neck. Otherwise, leave the head drape folded in place and away from the patient's head. Warning: do not allow the warming blanket or head drape to cover the patient's head or airway when the patient is not mechanically ventilated. Insert the end of the Bair Hugger warming unit hose into the hose port. Use a twisting motion to ensure a snug fit. Note the visual insertion indicator on the hose end to guide the depth of hose insertion. Do not treat patients with the warming unit hose alone. Always attach the warming unit hose to a Bair Hugger warming blanket or gown before providing warming therapy. Be sure to check that the warming hose is not resting on the patient or in direct contact with the patient's skin during warming therapy. Support the weight of the hose using an adjustable tethered sheet clip and attach it to the OR table or an IV pole. Select the desired temperature setting on the Bair Hugger warming unit to initiate warming therapy. Follow instructions for use in the operator's manual for the warming unit chosen. It is recommended to continuously monitor core temperature and cutaneous responses during warming therapy for patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to facility protocol. Adjust the air temperature or discontinue therapy when the therapeutic goal is reached, if elevated temperatures are recorded, or if there is an adverse cutaneous response in the warmed area. Follow the instructions for the specific warming unit to turn the unit off or place in standby mode. Disconnect the warming hose from the blanket and dispose of blanket according to facility protocol. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on the risk of thermal injury, altered drug delivery, interference with ventilation, and patient falls. Applicable to the use of the 3M Bair Hugger multi-position warming blanket model 622, which can be found in the device instructions for use provided with the blanket. The Bair Hugger warming system should only be used by trained medical professionals. If you have product questions, please contact your local Solventum representative. Call the Solventum customer care at 800-228-3957 or visit solventum.com. Solventum offers device training upon request.